Hi, it's Claire from Cluzie. Thank you so much for tuning into my frequency today. So today we just wanted to talk a little about chronic fatigue syndrome. Now, if you have ever suffered from chronic fatigue syndrome, you will agree it is devastating for your life. Now, the thing with chronic fatigue, it's one of those diagnoses that doesn't have a test. It's generally when there's been a group of symptoms come together. Then you fill in the criteria and then the doctors say chronic fatigue. Now, what causes chronic fatigue? Well, they don't know. But in our experience in the clinic, a lot of our chronic fatigue patients have had viruses in the past, whether it be glandular fever, Ross River fever, Brahma forest, or Q fever, or parvovirus, or some kind of virus that their immune system just hasn't been able to fight off. And when they go to bed at night, their immune system's so busy trying to heal themselves that they're exhausted. And this is just a cascade after cascade, cascade. And then they find themselves so tired that they cannot function. They struggle to get out of bed, they sleep, but it doesn't make them feel any better. And we've also seen chronic fatigue in people with some psychological stresses. So in the clinic, we aim to increase people's quality of life, because when you have chronic fatigue syndrome, and some people have had chronic fatigue syndrome for years, your quality of life is around 2 out of 10, if that. So at the clinic, we kind of stage our appointments with our clients to just slowly increase their quality of life, whether we help them with their immune system, aka the lymphatic system, or whether we help support them with their psychological traumas, whatever happens to be the case. We have a very, very high success rate with chronic fatigue clients, just like our fibromyalgia clients, because a lot of our fibromyalgia clients will turn into chronic fatigue eventually. So we have a really good success rate. If you know anybody with chronic fatigue, it is debilitating for them and their families. So please get in contact. Let me know here if you've ever had chronic fatigue syndrome. I know there's a few people I know that had it in high school that set them back and they had to repeat a year. It would have been horrible. I couldn't think of nothing worse than having to repeat high school. But anyway, chronic fatigue, that's what it is. What else can you do about it? Just, there's really nothing as effective as ANF therapy. So find an ANF therapist, have a conversation. And for those who don't have chronic fatigue but know someone who does, give them some empathy. It's not their fault and it's quite horrible for them. But anyway, thank you so much for listening, and we'll see you in the next video next week. Ciao for now.